Hi, my name is Dr. Stephen Stokes. I own Advanced Pain Solutions in Southwest Florida, and I've been in practice for just almost 20 years. The number one condition that I treat clinically is lower back pain. I have treated tens of thousands of cases, and I'm happy to say that most of those people did not need surgery. Maybe 2 in 100 needed surgery. That's all. So today I want to do a very important talk about lower back pain. I want to explain to you the cause of lower back pain, and more importantly, I want to teach you how you can help to permanently heal your lower back pain. When I say permanent, I mean that we are not going to talk about just palliative therapies that make you feel better. We're going to talk about ways that you can regenerate the cause of your back pain, regenerate the damaged tissue, and that is definitely possible. I'm going to present that case to you today, and I'm also going to give you references so that you can look up the references and see for yourself that you do not have to live in pain. So the number one cause of most cases of back pain is the muscles, right? Simple. So you do something, the muscle gets overstretched or gets overworked, you have a little bit of pain, goes away in 2 days. That's a common scenario. That is not what we're talking about here. What we're talking about here is chronic back pain. And the number one cause of chronic back pain is the spinal disc. Now, I've made many videos on this. The spinal disc is a cushion that sits between the vertebra of your back. You can see it here in the spine. And it's these cushions that sit between the vertebra. They're almost like jelly donuts. They act as shock absorbers. And they also keep the space between the bones apart so the nerves can come out. And those nerves that come out of your spine, they travel down into your legs. They travel to your major organs. They go everywhere in your body. When that is working properly, when that disc is healthy, it allows for movement. And that movement creates a slight pumping sensation that brings fluid in and out of the disc and keeps it healthy. When that disc gets injured, when it either gets torn or it bulges, it herniates, it protrudes, or it starts to degenerate, then that movement stops. The fluid does not get into the disc anymore, and that perpetuates the condition because the disc cannot heal unless the fluid, the blood and the oxygen, gets in and out of the cushion. The problem is that these spinal discs do not have a direct supply of blood. They don't have a way to get the blood directly in. You can't mainline it. There's no big vessels that go into the disc. And so all the fluids have to go in through this pump mechanism or this movement process that we're talking about. Now, this is not just my opinion. So this was all written about in 1996, right here, in this clinical symposia. And in this small publication, they talk about the fact that the spinal disc is the number one cause of the problem. They talk about the fact that the reason the disc gets injured is because it doesn't get enough blood flow and circulation. And they also mention that the spinal discs can definitely heal and the tissue can regenerate. And that can take approximately 500 days to do. So we're looking at a process that does occur, but it does take a period of time. It takes about 500 days for the spinal disc to regenerate, as long as you're not doing things to continue to hurt it, and as long as you're doing things to help influence that regenerative process, which we're going to cover next. So you've hurt your back. You've had a miserable back for a while now. You've tried your stretches and things like this. It's not working. And of course, it's not working because the cause is the spinal disc. First thing I would do is I would get a lumbar MRI of my lower back. Like I said, a lumbar MRI. You do not need one with contrast, in my opinion, initially. And if that MRI comes back and it shows that you have anything at all with the disc, so if it says anything like herniated, bulging, protruding, degenerative, if it says you have arthrosis, any of those things mean, in my opinion, that the cause of your back pain is going to be to do with that disc. Now, there are a couple of red flags we want to watch out for. The procedure that I'm going to describe to you that you can do on your own to regenerate your discs, that is not going to work if you have organic disease. So if your back pain is being caused by kidney disease or cancer or something like that, then this is not going to work, obviously. Also, there are 2 spinal conditions that this will not work for. The first is called spondylolisthesis. Spondylolisthesis is when there is a slight fracture in your spine and the bone of your vertebra has moved forward like this. When that happens, it compresses the spinal cord centrally, and that is a condition that, depending on the grade, they grade those. If you have a moderate or severe condition, a moderate or severe spondylolisthesis, based on your grade that the radiologist will give you, then you most likely will need surgery. You will need a spinal fusion surgery to stop the progression of that slippage. That's important. The second condition that this will not work for is called central canal spinal stenosis. There's two different types of stenosis. There's a stenosis where the little holes or openings on the side of the spine get narrow, or they close off due to arthritis and due to sometimes the disc bulging. That is something we can work with. However, if the stenosis happens centrally, meaning around the spinal cord itself, if the stenosis is building up in the central canal, then this is not going to work, and then you need something called a laminectomy, where we go in. We don't, but the surgeons go in and they clean that out. They do the rotor-rooter, right? And both of those surgeries work very well for those conditions. So if you have the MRI and it shows you have one of those conditions, then by all means consult with a surgeon and see what he thinks, because you may need surgery. However, if the cause of your back pain is, like I mentioned, with the spinal disc, then this procedure should really do quite well in healing the condition and relieving your symptoms. Now, I mentioned that one of the problems is you're doing things to irritate it. So what could that be? Number one is exercise. If you have these disc problems, you're not going to exercise it better, okay? So you need to not do movements that hurt it. It's very simple. If sitting hurts your back, don't sit as much. If walking hurts your back, stop walking as much. You understand? Whatever it is, if sit-ups hurt your back, which I'm sure they would if you have a disc problem, you don't do sit-ups. Movement is okay. Light movement, light walking. That stuff is okay because it gets your heart rate up and it gets the blood flow. We want to do that, but we do not want to do any heavy rehabilitation or exercise until the disc is healed. Secondly, a lot of people will do things that are counterproductive to this area healing, like they'll have a diet that consists of a lot of sugar. Sugar causes inflammation, of course, or they will have a diet that doesn't include a lot of animal products. I'm going to get some flack for this, and there are ways around it, but basically you need to have fats and protein in order to build the tissue that we need to build in the body to regenerate the discs. So if you're a vegan, for example, that's okay, but you're going to have to find ways to make sure that you get adequate amount of fats and protein in your diet so that the spinal discs can heal. Also, it goes without saying, smoking is a bad idea because it stops circulation, and so does drinking alcohol. So we're really dealing with a circulatory problem. That's why the spinal disc is not healing. We don't want to do anything that's going to make that worse. Now, what are the things you can do to influence or to help this regeneration happen over the next 500 days? And by the way, it's 500 days for the disc to regenerate. It's not 500 days to feel better. Most people will feel almost all their symptoms go away in the first 30 days of this program, which is pretty incredible. In fact, you should feel 50% improvement in the first 10 days. And you should feel 50% improvement in the second 10 days, etc., etc. So that's how you know if it's working. So if you've been doing this procedure, if you're doing this self-treatment that I'm going to explain, and you're not feeling at least 50% better in the first 10 days, it's not working, something is not right. And of course, you should be checking with your doctor on all of these things. I am not your doctor. I'm giving educational information here, not specific to your condition. That's my disclaimer, right? I'm just a guy on the internet. Even though what I have to say is very valid, it may not be specific to your case, so keep that in mind. Anyways, like I was saying, one of the things that you want to do, we're going to go through a list of the things that you want to do now to influence or to help with the regenerative process. The first thing is stop using ice. No more ice on your back. Moist heat. The best moist heating pad that I found is by a company called Battle Creek Medical Supply. And you want to get a moist heating pad, and you want to use that for 20 minutes as much as possible. Because heat influences blood flow, it dilutes arteries, it dilutes veins, it helps to get the circulation going. That's what we need. We only want to use ice if we're in so much pain that we need to numb the area. And then if we do that, after we numb it, we want to use heat. So heat is the answer for chronic back pain, not ice. Again, this is my opinion. Tens of thousands of patients, lots of good results. You can see lots of testimonials online, et cetera, et cetera. So I'm not going to try to validate that here, but trust me, you want to use moist heat. You want to stop using ice on your back if that's what you're using. Ice will retard the healing process, and everybody knows that. But why do we use ice? Well, because it numbs the area and it feels good sometimes. But let's not use ice anymore. Let's stick with heat. The second thing you want to do is you want to find a way to bring the circulation back into the spinal disc. And you can't do exercise because that area of your body is no longer moving properly because of the injury. So what do we use? We use spinal decompression therapy. Spinal decompression therapy is a great therapy with lots of studies behind it that creates a slight vacuum between the bones of your spine, and that vacuum draws in fluid, blood and oxygen, kind of like a sponge. Because we want to take that cushion, and a great way to think of that cushion is like a sponge. And if that disc is injured, that cushion or sponge is under load. It's under pressure. So if you think about this cushion in my hand, if I squeeze it really tightly and I put this in a bucket of water and then I open my hand in the bucket of water, the fluid absorbs into the cushion, and when I take it out, it's filled with fluid. This is what we want to create in your spine. We want to create a decompression of load in the disc like this slight negative pressure to draw blood and fluid into the spinal disc from the surrounding vessels in the vertebra. Over the last 15 years, I have also used a product and recommended a product to my patients called the Dds Belt, which is this belt right here. I have, it's a spinal decompression ear belt. I've done other videos on this, and I'd recommend that you watch that video. I'll put it in the links below. But what this belt will do for you is it will allow you to create that spinal decompression between the joints of your spine, between the bones of your spine, to draw the fluid in. And we have lots of MRI studies that show that if you wear this belt daily for a minimum of 2 hours a day, and you can even wear it while you're doing activities, then after 30 days of wearing the belt, we see a dramatic reduction, in the herniations and bulges of the spinal disc. And we also see an increase in the height of the spinal disc. An increase, meaning that on an MRI, that disc is now taller. That's only going to happen if that disc is getting fluid and regenerating. So it's pretty amazing. Of course, you'll use this belt for the first 30 days and experience symptomatic relief, hopefully, but then you will continue to use this belt on some level of frequency for up to 500 days. Because remember, the spinal disc takes 500 days to heal. So once you're out of pain, we don't stop there, right? We want to continue the process. You can purchase this belt from ddsbelt.com at a discount by using my code name, which is DR Stokes, S-T-O-K-E-S. That'll give you a discount. It'll give you, I think, free shipping. And more importantly, you will get a 60-day money-back guarantee on this device. So if you buy this belt and in 60 days you're not happy with the results, DDS will give you back all of your money, no questions asked. What more do you need to know? It's a no-brainer, and it's a great device. I have given out thousands of these over the last 15 years with DDS. I've had a great relationship with this company. I'm on a lot of their videos, and I have used this belt myself for my own back pain. I've given it to family members. I've had lots of people tell me that this belt works great. So that's going to be your main therapy, is you're going to use this DDS decompression belt. Also, we want to influence the growth of those little vessels into the area that we're trying to heal. And how do we do that? How do we influence the regeneration of the tissue itself? Well, there's an herb or an herb. I've never figured out if it's herb or herb, but we'll just call it a herb. So there's a herb called Gotu Kola, and you can get that from MetaHerb, and I would recommend a fairly high dose of Gotu Kola for the first 30 days of treatment. That is going to influence something called angiogenesis, which means it's going to promote the branching and growth of existing blood vessels in your back. More blood vessels, more blood and oxygen available for more regeneration. That's what we want to do. Also, studies have shown that Gotu Kola prevents a lot of scar tissue from building up. We want to grow healthy tissue. We do not want to grow a lot of scar tissue. The second thing I would look at is if you're in pain especially, is I would stop taking any kind of non-steroidal anti-inflammatories. Instead, I would switch that with willow bark and fish oil. I did a video on this as well that you can watch. But basically, willow bark is a natural product that's a great anti-inflammatory for this type of condition. And when you take it along with fish oil, it really is stellar. There's a lot of great studies on pubmed.gov that show the combination of the two reduces pain as good as most prescription painkillers. So you want to definitely take that. The product I recommend by MetaHerb is called Salagesic. That's the white willow. And in combination with the fish oil, I like standard process calamari oil, or if you don't want to drink the oil out of a jar, if you'd rather have a capsule or something like that, take the tuna oil. And again, reach out to me for dosages and for more information on that. You can buy these products directly from Standard Process with a patient direct account. Information on my website. So during this time, when you're trying to heal your back, we are using the belt, we're taking some supplements, and we're making sure we eat lots of fat and lots of protein in our diet. We want to also make sure during that time that we are active without hurting our back. If you can walk, then I recommend walking no more than 1 mile at a time, a 20-minute mile, with the belt in place. And what that's going to do is the belt is going to decompress the spine, but then as you're walking, it's going to influence the movement of those vertebrae, which is going to further help get the fluid into those areas. So that's what we want to do. Don't do yoga. Stay away from exercises. Stay away from heavy stretching. You know, people always tell me, oh, well, I know what's wrong with my back. I said, well, what's wrong? They said, well, Piriformis Syndrome, because they saw it on the internet. So 20 years of practice, tens of thousands of resolved back pain cases. I have only ever seen a handful of true Piriformis syndrome, and those were in professional athletes. Most of the time, when someone says it's Piriformis syndrome because it hurts in their butt cheek, it's not Piriformis syndrome. It's in fact sciatica, and that sciatica is caused by, you guessed it, the spinal disc. So that's what I normally see in the clinic. Not to say you don't have Piriformis syndrome and you shouldn't be stretching it out like a maniac 3 or 4 times a day. And hey, if you do that and it works, then you had Piriformis syndrome. But most people will find that will irritate their back or give them only temporary relief. So I would strongly recommend the MRI and then going with the protocol that I just outlined. If you're somebody who is dramatically overweight, 100 pounds overweight, and you know you are, and you can't move around at all, you're in a chair all day long, then you know what? Look at going on a moderate protein, high fat diet. Again, links below. I give a protocol of that outlined for free that you can follow. That has been, by the way, endorsed by the Mayo Clinic. So you can look into that. But get your calories down so you can burn off some of that excess weight. That's going to make your back feel better, of course, because there's less pressure. And also, if you can't get up and take a walk, you can rock. You can rock and roll, and that'll help your back a lot too. So you can get a rocking chair, and you can sit there, and you can practice rocking back and forth, and that rocking motion is going to activate the pump mechanism in your spine, help with circulation. I hope this was useful. I hope that you will reach out to me if you have any questions, or if you'd like more specific help, just reach out. I can be found on my website or in the comments sections below. I'll answer your questions. If you would like to read in more detail about this protocol, including all of the reference material, for example, when I mentioned this book, all the actual pages and the reference guides, you can download a free copy of Heal Yourself, The 7 Steps to Innate Healing, from my website, drstephenstokes.com. It's a free download, and this has an entire section on back pain that you'd be very interested in. Okay, thank you very much, and I'll see you again soon.